Hi, my name is Sara. Now I will talk about the extra-oral examination of this female patient. First of all, the frontal examination at rest. The facial form is tapered. The lip competency, they are competent. The mesoprosopic measurement, as this patient doesn't have too short or too long face. The facial symmetry, the facial midline show asymmetry because the right side is larger than the left side. The transverse fifth, the lateral fifth of the right side is larger than the left side, and we have narrow mouth in relation to the interpupillary distance, which is more observed in the left side because of the facial asymmetry. The frontal examination at smile, the incisor display, they are almost 90% of the incisal display, and adequate gingival display, which show the interdental gingiva. Smile arc is consonant with the curvature of the lower lip, and the maxillary midline is coincide and parallel to the facial midline, whereas the mandibular midline, it is not visible. The soft tissue profile, the angle of convexity, this patient have slight facial convexity because it is 13 degree, which is considered as normal because the mean value is 12 plus or minus 4. The vertical facial proportion, we have decreased lower facial height because it is 1.8 centimeters, whereas the upper facial height is 2.3 centimeters. The lower facial height has normal concentration because the upper lip is 1/3 of the total length. The nasolabial angle is 112. There is slight obtuse angle because the normal angle is from 90 to 110 degrees. The maxillomandibular prognathism, the SN point is touching the vertical line which is drawn from the glabella, whereas the pogonion is 1.5 mm from the vertical line, so it indicates retrognathic maxilla and orthognathic mandible. The assessment of the nose, we have different angles which indicate for aesthetic purposes. First of all, the nasofacial angle, it is considered as normal because it is 34 degrees. The nasomental angle within normal range because it is 132. The mentocervical angle, it is increased because it is here 124, whereas the normal range, it is between 110 to 120. The submental neck angle, it is increased also because the normal range for women is 121, whereas this patient has 134 degrees. The lip position, first of all, the lips are within normal position in relation to the E-line because the upper lip is 1.5 mm from the E-line and the lower lip is 1 mm from the E-line. The Burston line, which show retrusive upper and lower lip because both lips are touching the Burston line, but in the normal ranges, the upper lip should be 3 plus or minus 1 anterior to this line, and the lower lip should be 2 plus 1 or minus 1 anterior to this line. The S line also show lips within normal position because both lips are touching the S line, because 2 forward it is considered too prominent and 2 backward it is considered as 2 flat lips. The Merfield Z angle, it is considered normal. We have here 78 degrees because normal range 80 plus or minus 9 degrees. The interlabial gap, the distance between the upper and lower lip, here it is 1.5 mm. The mean value is 2 plus or minus 2. The problem list, first of all, the anterior-posterior plane, skeletally we have retrognathic maxilla. Soft tissue, we have slightly obtuse nasolabial angle and retrusive upper and lower rib in relation to the Burston line. Vertical plane, skeletally we have decreased lower facial height. In the transverse plane, we have skeletally facial asymmetry. The transverse fifth, we have the lateral fifth of the right side is larger than the left side. And transverse plane within the soft tissue, we have narrow mouth in relation to the interpupillary distance. Thank you.